Operation Dudula members stormed into a public health facility in Soweto today to check the nationalities of those queuing to get help. The group has since left the clinic. Earlier, Operation Dudula members appeared in the Orlando Magistrates Court for disrupting services at a local clinic last week. The organization launched a nationwide campaign in June to prevent undocumented foreign nationals from accessing health care at public facilities, saying systems were overstretched and government had failed to enforce immigration laws. Well, I'm joined now by Mametlwe, Sebei, an attorney at Lawyers for Human Rights. A very good afternoon to you, Mr. Sebei. Thanks very much for your time. Just your thoughts about what Operation Dudula has been doing at these clinics, following, of course, in their launch of their campaign a couple of months ago.
Well, there's no doubt in our mind that they are breaking the law. The Constitution is absolutely clear. Section 27 says that everyone, and by that they mean everyone in the country, has a right to health care. And obviously, that is further elaborated in the National Health Act. And I think from that logically flows an obligation on the part of everyone, including members of public, to refrain from interfering with any person trying to access healthcare or any healthcare facilities for that purpose. And Operation Dudula has been in violation of that. And I think they have been rightfully apprehended, and we hope that they will be held to account for this and other violations of the rights, particularly of the migrant.
Are we paying the price here for the government's inability to do what it's supposed to do, whether it's at the borders or whether it's police, and whether, are we not paying for the failures of the government here?
Certainly. I mean, you look at the issue, some of the issues that they are raising, the issues of, the fact that people are here, they are not documented. I can tell you that a lot of migrants in this country want to be documented. Here at Lawyers for Human Rights, our law clinics are always full with migrants that want to be documented. And partly part of it is the austerity measures that include, amongst others, government actually closing reception offices at the ports of entry, which therefore means that today you enter South Africa, and only when you are inside and you are somewhere, you get to somewhere in Pretoria, and you are able then to apply for documentations. Even that process is becoming more and more impossible for administrative reasons, due to corruption and many other things, as of course the laws are also becoming, much more xenophobic. But also think that the main crisis here is a crisis in the healthcare sector. And the problem, and which is where you can see that there is a misdirection of the anger, of many, of the members of Operation Dudula, who probably, like all of us, have every right to be angry about the state of healthcare and its ability to provide quality public services to everybody. Our clinics, our hospitals are understaffed. There's shortages of medications, and of course, without equipment necessary to provide proper treatment. And that's because healthcare, unfortunately, remains racialized, remains privatized, remains monopolized. And you can see who gets to suffer. You look at the distribution of spending on healthcare income in this country, right? 570 billion spent annually. 51% of that goes to a private healthcare that only cater for 14% of the population. 49% go to the public healthcare that, of course, caters for 86% of the population. 10% of the Black population has access to private healthcare. The number for the white population is in the opposite direction. That is a problem, and the problem is corporate profiteering, particularly by the three big companies in the healthcare industry: Life, Mediclinic, and I think Netcare, that are owning 87% of the private beds, and of course have increased profits by making healthcare inaccessible to the vast majority of the population.
Now, your organization has warned that the government can be taken to court if it fails to intervene in these instances.
Absolutely. I mean, there's absolutely no doubt. I mean, that flows from, the Constitution, that is binding on the conduct of the state, both obviously the healthcare ministry and of course the service itself, but also on the police in terms of their obligation to enforce the law, including protecting the rights of those whose rights, in this case, access to healthcare, are being violated. There are also a number of international obligations that are binding on the state and, of course, require of it to take measures that we see they have begun to take in terms of holding those responsible for this mayhem and, of course, for violence accountable. So, but that said, and I think this is a point to underline for you, we are not indifferent to the plight of the Black working class people in terms of the crisis of access to healthcare. And I think this point needs to be emphasized. You see, this country, for you, is already spending more on healthcare than what is even recommended by World Health Organization that recommend 5% of the GDP. We are spending 8.5% of the GDP. The question is a distribution of this, healthcare spending in the private sector, but also the private sector that is wasting obviously money because lots of it is siphoned by the shareholders of these big corporations. I mean, you look at medical care industry, right? They spend 28 billion annually just on administrative fees. 28 billion real is enough to construct and finance 40 hospitals, 40 new hospitals in this country. You could basically have new hospitals in every district across the country. When you look at over 77 billion that is being made by in the profits of the big healthcare monopolies, that would be more than enough to make sure, along with what is being spent on the medical aid, to build over 100 new hospitals to ensure that those hospitals are properly, equipped in terms of facilities, in terms of the medical equipment, are properly, obviously, staffed with the doctors, the nurses, dentists, and all the specialists we require, and of course they are adequately supplied in terms of medication. That's what the anger must be focused on. Why is it that so much of spending on healthcare goes to so few people, but more than that is enriching the shareholders of the big operations at the expense and the misery of many of us who are losing our loved ones to unnecessary death because the healthcare in this country is not underperforming by every measure. Life expectancy, maternity death in this country, right? But also how many people die needlessly from minor injuries and illnesses that can be treated if only the services were up to standard, the medication was there, but also there was a proper and adequate staffing of the hospitals and clinics.
Do you feel the government is listening?
Well, certainly not. And the problem with the government in this country, obviously, is you are dealing with a neo-capitalist state that is obviously committed to a brutal neoliberal policy that is out of sync with the realities of this country and the need to make sure that we massively redistribute wealth. I mean, the fact that 30 years into democracy, under a black majority rule, this country is more unequal than it was under apartheid. I mean, they are putting, Verwoerd must be blushing where he is, looking at what the ANC actually has been able to achieve by comparison to his system of legislated inequality. So the problem is, you have a government that is committed to a monopolization of the private ownership, not only of the means of production, of the economy, of the minerals, of the land, but also it has privatized the most essential public needs, including healthcare and, of course, education and many others. And that's the reason that it's not only healthcare that is targeted It is also, the schooling that they are targeting, a number of that and so on. And this is obviously threatening, the cohesion of the country. I think it will end with the migrants. Just look what is happening in Eastern Cape. In Eastern Cape, the main fight is not between migrants and South Africans. It's people considering themselves native, right? Native to Western Cape, to those they consider to be the migrants from Eastern Cape. And that's true in a number of regions. You were just having a story here about people wanting to opt out of municipality. That is in Bombela. I have the same situation at home. What it tells you that the center cannot hold. People think, government, the state is only ever benefiting people from a particular village, from a section of the municipality. So you deal with, or even if you evict all the migrants, the problems will remain. We'll start closing each other off on the basis of provincial, regional, and even local boundaries. And sooner or later, these countries start to disintegrate, and you have the kind of a catastrophic civil war that you have across the entire continent.
Mametlwe Sebei, let me thank you very much for your time. He's an attorney at Lawyers for Human Rights.